Hey, so got this to help so I don't have to like adjust my head to talk. I just talk. Hopefully it's coming through. But yeah, so still doing the iron neck, still doing the head harness thing. Show you. Let's see what we got here. This. Uh, uh, this thing you can YouTube iron neck, and this is I don't know what it's called. I just call it a head harness, but it's just like you put this strap around your head, so it's like goes under your jaw and around your forehead, and this chain hangs off it, and then you can do like flexion extension exercises. And if you lay off like the side of your bed, you can do like sideways too, both ways, which is really good. I think a four-way neck machine. Well, I don't know. I never used a four-way neck, but a four-way neck machine is similar. But this is a free weight versus a machine, which is not a free weight. So there's the whole argument of like weights versus like machines versus free weights. And free weights use stabilizer muscles. So your neck is unstable. You probably want to exercise the stabilizer muscles. Usually do lighter weights on free weights than machines because machines isolate the movement, so we don't have to worry about stabilizers. And I think it's kind of I don't think there's necessarily always muscles dedicated towards stabilizing, like, but sometimes there are. Um, but sometimes you're just using your muscles in addition to lifting the weight into holding the lateral motion. So if you're using a free weight like this, you have to stabilize your arm from wobbling like that, versus like a machine where it doesn't let the weight move left and right. It only lets the weight move up and down, so you're not stabilizing. So anyways, so you're doing that for your neck. So I'm doing that. And my neck's tired because I was doing that yesterday, but it's good. I've also been doing like all of the attachment points for the tendons on every vertebrae, because you have tendons that attach to all the transverse processes, the parts that stick out in each spot on each vertebrae. So your scalene's attached down here, and then they go up and attach, I think up to like about C4. I could be wrong, but they go up, they attach around here, and they attach around here, and they help stabilize your head if you're leaning forward, and they also can pull your head forward in addition to your SCM muscles. So it seems like your scalenes do both. Well, I guess all your muscles stabilize your head in all directions, but primarily it's for pulling your head forward. So like if you lay down and tuck your chin to your chest and like lift your head up, like they get super engaged that way. So in bed I'll do like sets of 10 where I'm laying down and I'll pick my head up and go to my chest and then lay back down and then go to my chest, and then it's helped because the tendons all through here on the transverse processes all hurt a lot, like a lot, all the time. And like if I leaned forward, if I was leaning back and I was like holding my head up like that, they would really burn. So I was like, well, I need to go through the whole range of motion of that and not just like hold it in a spot, because that's what causes tendonitis and tendinosis, which breaks down the collagen. So when you're exercising it makes the connective tissue grow. Like it's just like if you lift weights, like you do curls, it makes your bicep grow, it makes your forearm grow, it makes the tendons in your elbow grow, and it makes the ligaments in your elbow grow. But if you just like hold a weight like that, then your muscles and your tendons and whatnot are going to start burning, and then they're going to start falling apart, and you don't want them to degrade, you want them to grow. So what I was doing was I was just like hold, like if I was like someone was talking, I'd lean up like this and talk to them, if I didn't, if I was just like this and then I'm talking like this, and it's like because my chin's like tucked into my throat. So um, anyway, so I was doing that with my neck, and then all the tendons are burning. The exercise is helping the tissue grow, and so like I'm touching. I have to like push my SCM out of the way to get to it, but it just doesn't hurt as much as it used to. Even after a few days of doing it, I'm like, holy crap! Like it's the first time in like 7 months. There's not much pain at all, and I'll keep doing that, and hopefully that'll just cure all that problem. So, and nobody ever suggested that to me. Dr. Santana, Dr. Schultz didn't suggest that. Dr. Pappas didn't suggest that. I told all of them. I actually I didn't tell Santana. I told Schultz office. Um, Nobody suggested. I went to orthopedic doctors, neurosurgeons. I went to the emergency room, urgent care. Everyone knew that I said my transverse processes, the tissue on them hurt, and what connects to bone is connective tissue, not muscle. So if something's touching your bone and it's tissue and it hurts, it's soft tissue, it's tendons or ligaments. So I have a bunch of tendon problems. The way you solve tendon problems is through exercise. Nobody suggested that. Um, some people suggested physical therapy in general, but when I went to the physical therapist, they did not have me doing that, like exercise forward like this. They were like, do like this and like chin tucks. That didn't address those tendons because they're not really used in that respect. Not that much. Um, so flexion extension like this, that really uses your scalene muscles. Extension, I forget what's flexion extension. Flexion's down, extension's up. And then your um, traps, which connect all through your spine as well. But I think they attach more towards the middle of your vertebrae rather than the transverse processes. And they go all the way down your back, your shoulders and your back. And they're used when you do like extension, like back, and then lowering your head back down into neutral. Uh, so they're used for this. So that's also why the head harness thing is good, because I can use those and strengthen those tendons. Ligaments also grow. Like I talked to doctors about all my ligament damage, and obviously Dr. Santana and Dr. Schultz are big on physical therapy and doing exercise to build tendons and ligaments. It's just for that specific thing. I'm like, for months, I'm like, guys, like these things are killing me. Nobody mentioned that they have anything to do with the scalenes. I had to like look up anatomy and be like, well, there's only one tendon. And there's not. I think there's also muscles that connect between the vertebrae, but otherwise, it's your scalenes that connect to the transverse processes in that area, like C4 down through. Like I can even feel it like in here, um, probably through your whole spine. I only looked at the neck, but I mean the transverse processes are there for a reason. I'm not saying the body is perfectly designed and everything has a perfect reason, but they're used. So anyways, like if we were perfectly designed, we would have thicker vertebrae, we would have thicker ligaments in our spine, and we would have thicker discs because we're upright species. But our bodies haven't adapted to that so well. Um, anyways, uh, so we have that issue, and I'm working on that. And I just wanted to say, like, because when I give advice, people will be like, "Well, my doctor never said that." I'm like, "Yeah, they never told me that, and it works." and it's obvious. Like I had problems with the tendon in my elbow, really, really bad. Like I would squeeze in here, um, right in the tissue in there, and that's the soft tissue, and it's right where it connects to the bone, and it would hurt so bad I'd be screaming, and I started doing curls, and it went away. So it's the same thing. It's just tendon here or the tendon here, and then you're doing curls here, and then the tendon grows. And ligaments also grow with exercise, because if they didn't, nobody would be able to lift weights. You'd have no bodybuilders, you'd have no NFL athletes, there'd be no any, because the tendons and muscles would grow, the ligaments wouldn't, and the spine would just tear itself away from the rest of the body. So obviously the ligaments are growing too, although I don't know if it's a bit slower than tendons. I've looked at research, and it's hard for me to research online because it's hard for me to use a computer. But from what I've read, they take a little longer to regrow. And there's also issues where, like, if you have, there's also places where you're like, it's beyond rehab. So, like, if you tear your ACL in half, you can't just exercise it and have it grow back because the two ends aren't connected anymore. And there's people working on like lattice work that you can connect the two, and then you don't have to get a cadaver replacement to replace the whole thing. You just like you're basically sewing them together, putting a little gel in there, and then they grow across this gel, and then the gel goes away afterward, and the sewing needle and the thread goes away. That principle, I don't know what, you know. But it's not heavily used. So anyway, there's things where it's beyond rehab. Like I couldn't have done this exercise before I got PICL because I would do like a little bit of resistance with the back of my hand and go like that, and I would feel something tear. It was like it was impossible to rehab my neck because any amount of pressure would just they just tear it. So it wasn't possible. So after like PICL and like slowly doing a little more each day, got to the point where I could do more exercises. But I still usually wait like 3 days in between exercises. So if I work out and I do a set of any exercises, elbows, riding a bike, um, anything, push-ups, then like if I do it on a Monday, then Tuesday, Wednesday, Thursday, I don't do that, and then Friday I do it again, and I do like a little bit more, a few more reps, because the muscles are ready to go in 2 days. They're ready to go again, but the connective tissue isn't. Connective tissue for me takes twice as long to grow, and I take vitamin C, I take vitamins, general vitamins, I take time release vitamin C throughout the day. I get a lot of protein, so it's like I'm getting everything I need. It's just, I mean, anyone will tell you connective tissue takes longer to heal than muscle. And I'm sure anyone who's listening to this has experienced that. You work out if you injure your elbow, or you hurt your rib, like the collagen in your rib, it takes like a month to heal. If you pull a muscle, it doesn't take that long, generally. Yeah. So anyway, so that's what I'm doing for my neck. The ALL, I felt tear, so I've been trying to take it easy and like leaning forward. I felt damage on that, but that wasn't from any exercise I did. That was from when I put the soft collar on. I was like, cool, I have the soft collar on, I can do whatever I want. And then I was leaning forward doing the dishes for like a long time, way more than I ever do. And all of this was isolated, and just the top part of my neck had weight on it from my head, so it created a hinge, and my head was hanging off of that hinge at the top. And because when you wear a neck brace, it basically makes your neck solid, one solid piece. And then that hinge at the top, right above my C1, the ALL in the front really started burning and hurt really bad. So I'm trying not to lean forward at all, and trying to rest as much as I can. I still do my exercises by resting my neck, and I'm trying to keep my head upright. And aside from exercise, I'm not like leaning forward. And I'm being careful with exercise. If I feel any kind of twinge or if anything exacerbates it, I stop. So if I normally would be doing like laying down, flexion extension on my bed with no weight, and I do like 3 reps and it starts to hurt in the top of my ALL in the front of my spine. Like the anterior longitudinal ligament runs in the front of your spine. It's a vertical thing that like holds it in place, and then on the back of your spine you have PL, posterior longitudinal, and they hold your spine as it like moves forward and backward and like keeps it in place. And the top part of my the front one towards the front of my neck, like behind my throat, that hurts really bad at the top. So the exercise has been helping, but I treated the collar as like a free lunch, and it wasn't, and it hurt me. So I just threw my collars away. I'm like, I'm done with them. They've hurt me multiple times in the past, like, because they isolate your neck here. So at the top part, there's a hinge, and at like your C6, C7, there's a hinge. And both parts have been injured by leaning forward and doing stuff. And I'm just like, I can't do that anymore. If I'm tired, I just need to rest. Um, and I can't wear a collar at any time. It just hurts me. It's bad for you. It's just bad. If you have to wear it, you have to wear it. But if you can get away with not wearing it, don't wear it, because it will hurt you. Um, and let's see, still taking antibiotics for Lyme. Still doing herbs for Lyme. Cat's claw, Japanese knotweed mostly. And I got some kind of mushroom thing. Basically, I just go on Amazon and I type in Lyme, and whatever comes up, I just buy those. Like, because there's like the combination thing that has all the stuff that kills it in one, and it's like really expensive. But if you look at the ingredients and just buy each one individually, it's like 1/5 as much money. So I do that. So I have like, and I don't buy the pills, I buy the bags. So that's like 1/10 as much money as just buying the pills of the all-in-one Lyme thing. And so I have bags of herbs that aren't pills, and I just mix them in coffee and stuff like that. Put like stevia in it to sweeten it. It tastes pretty good. Cat's claw tastes kind of like ass, so I don't like that. But the rest of the herbs taste good. Japanese knotweed has like the nice earthy tone. It's really, I like it with, mix a little cocoa and stevia in your coffee with that, and it's really good. And some goat's milk. It's like, oh my god, it's heaven. Uh, Looking at jobs for maybe something where I can talk and not look at a screen really. For screens, the problem is like I tense up because I have such bad like because I often like when I'm looking at a screen and stuff's moving around on the screen, I'm trying to focus on like especially my cell phone, well even a computer, like stuff's moving, like a book hurts me. So forget about screens for a second. Reading a book hurts because I'm like holding my head in place, going across the page, just moving a little. And my next, maybe as my neck gets stronger, it'll be no issue. But holding my head in a position and holding the book in a position, because when you're reading a book, you're holding your head in place when you move your eyes around, and it's hard not to move your head a little bit here and there, or lean forward a little bit, or turn your head a certain way to adjust. It's just natural to, when you're looking at something, not just adjust your hands, but to adjust your head as well. So, like if I'm out working on my bike trying to adjust the brakes, um, I'm I have to consciously keep making an effort to sit perfectly level and straight and use your hands. And if I need to adjust, move my whole body and not like lean all. So it's not just a screen thing, but screens are worse because stuff's moving around on the screen and I'm trying to focus a mouse cursor on a specific spot. So naturally, when you're trying to hit a target on a screen, like you try and keep your head extra still, when you tense your muscles up a little bit. And for a healthy person, it's not such a big deal. But I also believe that a lot of people with cranioscervical instability stay bad because they keep using the computer and they keep using their cell phone extensively. So they just keep making it worse, and they think, why do I still have vertigo and why am I not getting better? And it's like you keep hurting. Like using computers is one of the worst things you can do, and using cell phones is one of the worst things you can do for your neck. Like I could be out there working on my bike, leaning over and doing stuff with a wrench for an hour, or I can use my cell phone for a few minutes and it's the same amount of neck strain. So it's like it is a lot of neck strain to use a computer and a cell phone. It's a lot, like a lot, a lot. There's nothing you can do that's more neck strain aside from like vigorous, like lifting and exercise. So if you have craniosacral instability, you gotta say like, I'm not gonna try and focus on things that are in front of me, close to my face. I mean, you could exercise. You do like, I'm gonna read for, you know, a few minutes, and if it starts to become uncomfortable, I'll stop. And just, each day do like a few more minutes and a few more minutes, like that. But like write it down. And if you're gonna use a computer, write it down. Have a timer so you don't lose track. And say like, I'm gonna do, you know, every couple of days I'll have my 15 minutes on the computer, and I have no pain, so that's okay. And then after like several times of that where you're like, I have no pain, okay, I'll get to like 16 minutes or maybe 18 minutes, and then set a timer for that, and just eat and don't do more. It doesn't matter how much you want to do it, because computers are the only thing more addictive than computers and cell phones is hard drugs. But I would say computers and cell phones are more addictive because I can do opiates. I can get high as a fucking kite on hard drugs, on heroin, morphine, and I can just stop. It's not an issue. But stopping using a computer is extremely difficult for me. Stopping using a cell phone is extremely difficult in comparison, because that's all of my ability to communicate with people. It's a constant endorphin and dopamine hit, and it's a constant way to focus my brain and not think about the pain I'm in my shitty life and all that stuff. And even heroin doesn't do that for me. So it's more addictive than heroin. So you really have to like, don't just forget about your ego. Set a timer on reading or set a timer on the computer and just be like, this is all I'm doing. And if it becomes a little bit uncomfortable, stop. So, speaking of uncomfortable, oh, trying to hold my head in such a way I can enunciate while reclining is difficult still. Tiring. But yeah. So I got surgery coming up, and I got I don't know when, I got Dr. Larry Lowe telehealth on Wednesday. Gonna talk about what goes into the surgery. They just want to do the right side transverse process. I gotta see, are you gonna cut off the whole thing? Because if they're gonna cut off the whole thing, I don't want that to happen, because muscles are attached to that that stabilize the vertebrae, and I don't want to get rid of those. And then I also want to inquire about the left side, and then yeah. So I think that's everything. I have a GoFundMe for a guy, Dr. Tariga, not Dr. Tariga, Dr. I forget. He's a local doctor in Columbus, Ohio. They can do upper cervical stuff. Can't do ALAR, unfortunately, but you can do everything else in upper cervical. Well, you can't do ALL. You can do everything you can do from the back, except for capsular, ALL, and ALAR. And so he's going to do that. And I need that because I still have grinding. Like, I'm stronger from the exercise, but I still have grinding. Yeah, I hit like pops when I move like this, and it's like it just grinds the whole way. So those ligaments are not really getting better. So I need help. I need prolotherapy injections. Have helped me in the past significantly. It's about $1,000, and I really need the help. So if you can help me, I appreciate it. People that donated in the past, I used that to get injections at Dr. Doriga in Cleveland, and that helped me a lot. I don't have any pain at all for the ligaments that connect to your transverse process and C2. They were burning all the time when I would lean forward, and they don't burn at all anymore. So a month later, yeah. So it's like phototherapy really helps too. You don't always need stem cells. So please donate to that. Thank you.